Hi, Barbara Wally here, orthopedic and sports certified physical therapist, to talk to you about low back pain. This is part one of a 4-part video series talking about low back pain, what it is, and exactly what can be done, most specifically with physical therapy. I am a physical therapist, so let's get started. So first off, what tends to cause low back pain? There can be a variety of issues that can cause low back pain, but to speak more specifically, there can be incidents where you have more of an acute incidence of low back pain where you kind of know exactly what happened, or that maybe you specifically caused an injury to your back, or there can be times that low back pain just sneaks up on you and you're tending to have issues with low back pain out of the clear blue sky. But there is a theory that our bipedal or walking on 2 feet status over time may be a huge reason why we have issues with low back pain. Just the way we were structurally designed back in the day to be on 4 arms and legs, and now that we're on 2 feet, may have caused a predisposition to low back pain. Also, our modern life. We do things a little differently today compared to when we used to live. For example, we sit a lot more. We sit in cars, we sit for work. So a lot of sitting or sustained postures, even in standing, may be to blame for issues with low back pain. And that's just to name a few things. But let's talk about a couple types of injuries. Let's talk about acute injuries versus chronic injuries. Acute injuries are like that time you actually hurt yourself. You can speak to a specific incident, say a car accident or a fall, or you lifted something really awkwardly at one point. Or you might have just woken up suddenly with low back pain. These are acute injuries. They tend to be new. Those are going to be treated a lot differently than, say, a chronic injury. And typically the definition of a chronic injury is any kind of pain or issue that has lasted longer than 3 months. And acute injuries can most definitely turn into a more chronic injury as well. And with chronic injuries, a lot of times there's no specific onset, there's no specific issue that brought on the pain. It's just something that's been lingering for a long period of time. Another reason for low back pain, and this is a big one, especially with what I do for a living as a physical therapist, is posture. Excuse me, sitting postures. So tending to sit with a big, hunch to your back, sitting at a computer screen, being hunched over, or even sustained postures in standing or in sitting. Heavy lifting can be a big one. So anybody who has a job where they tend to carry or lift or push very heavy weights around. And I did get some numbers. So men, typically about 50 pounds or 25 kilograms. Women, that's about 35 pounds or about 16 kilograms, are the high limit of what is safe to lift, especially repetitively without assistance from another person or a mechanical assistance with lifting. So I'm not talking about weightlifting in the gym. I'm talking about more those repetitive, lifting positions with a job or repetitive things that are being done throughout the day. But also we have to think about our sedentary nature in our culture, where we tend to sit a lot more than we did, say, 100 years ago, where people had to farm and they had to do a lot of things that weren't, what look like today's culture, where we drive everywhere we go instead of walking everywhere we go, which can cause weakness in our core, and it can cause issues with tightness in our muscles, where if we're sitting all day long, when we go to stand and walk, those muscles that kept us sitting all day long are going to have a hard time stretching. And whenever we're in those one positions or repetitive motions all day long, our body's not going to be as able to handle any sudden stressors as well. So if you go to lift something and your body's really not set up or made to do that activity, then you are at more of a risk of injuring yourself. But also, to the other side of the spectrum, you can also be a little too active. So we do have our weekend warriors, or people that tend to do a little bit too much, so they're a little bit too active, and you tend to push the range of what the human body can handle. But also thinking about childbearing, women who have a lot of children, that's a lot of strain on your system to carry a child for 9 months and then to also deliver a child. Also to think about weight distribution. If you tend to have a larger abdomen, that can be very hard on the low back. And even a lot of weight around your hips can put a lot of strain on the low back. But having awareness and access to resource and healthcare has also made it a lot easier for us to track that people tend to have low back pain. People didn't tend to go to the doctor back in the day, or if you had back pain, you just dealt with it. You learned how to deal with things on your own. And you can't forget that we are living a lot longer than we used to. So there's a lot more issues with arthritis, especially later in the years, and having to learn to deal with those issues and stay healthy and active throughout your day. But this is just a general synopsis. I'm sure there might be a few things that are missing, but it's a really good review of exactly what tends to involve low back pain and what can cause low back pain. So in essence, we have acute and chronic injuries. You can have an injury where you know what happened, or an injury where it's completely insidious or you don't know what caused the injury. There's also posture, heavy lifting, and genetics. Genetics are a big one. You can have issues with spinal stenosis or a weakness in a part of a vertebrae that runs in the family, sedentary nature or too active, childbearing, as well as weight distribution and awareness and resources that we have to access healthcare and resources for low back pain. And we are also living a lot longer. So I hope this was informative. And our next video, we're going to talk about treatment interventions with low back pain. I hope you have a great day and thank you so much for listening.